Hi, I'm Shernan Holtan from the University of Minnesota. We studied urinary-derived human chorionic gonadotropin in the setting of life-threatening acute GvHD. We define this as Minnesota high-risk acute GvHD or acute GvHD in the second-line setting, either steroid-dependent or steroid-refractory. So we think the best use of this drug is in the frontline Minnesota high-risk setting, using it as soon as possible in the disease course. Most of our patients had lower GI acute GvHD, and so that is where we would recommend its use. We definitely saw nice responses in the GI tract. Relatively few patients had isolated skin disease because, again, this was Minnesota high risk, so most of our patients had gastrointestinal involvement. It's a simple medication to administer. We gave it subcutaneously every other day. And you can monitor the absorption of this medication by testing human chorionic gonadotropin levels in the blood. One pro tip I suggest, though, is use the uhCG tumor marker for evaluation, because if you use the pregnancy hCG test, patients will show up as being pregnant, and this could be an issue, particularly for females who are undergoing procedures or testing. They will show up as pregnant. So when you're monitoring using this drug, I would recommend using the hCG tumor marker. We think that this drug has a number of potential mechanisms that it uses to help improve outcomes in acute GvHD. The first is being immune tolerance. Human chorionic gonadotropin is clearly associated with fetal maternal tolerance, and so it can be useful in acute GvHD as opposed to the concept of just immunosuppression. We know that this drug also has high concentrations of epidermal growth factor in it, and so it can also aid in tissue repair. And finally, it has anabolic effects. So anabolic effects can help people feel better, help them eat, help them have more energy by way of increasing their testosterone production. That occurs just while the treatment is ongoing. Once treatment is off, testosterone levels fall back down to their baseline. But certainly we think this could be a benefit in patients with acute GvHD. So again, to summarize, we recommend using this in the high-risk setting, especially with GI involvement, as early in the disease course as possible. And it's a very useful adjunctive medication to standard corticosteroids, and is commercially available and inexpensive. So we definitely are encouraged by our results, and we'll be looking at this further. Thank you.